I'm Cassie Richards, and today I am going to be demonstrating a intramuscular injection, and it is going to be of the Pneumovax. And I know usually the Pneumovax comes in a pre-filled syringe, but today we are going to be drawing it up from a vial. First, I would make sure I have all of my supplies ready, which I do. I already have them all laid out and ready to go. Then I will make sure and verbalize my 6 rights. So we have our right patient, which today is going to be Skip Rocker. And then we are going to do the right drug, which is going to be the Pneumovax. We're going to give 1 milligram. It is going to come in a 2 milligram per mil dose. So we're going to give 0.5 mils. So that is going to be the correct dose, will be the 0.5 mLs. Then we're going to give it the right route, which I already have said is going to be intramuscular. And we are going to be using the deltoid today, right here in the arm. And then we're going to be giving the right time, which says now. So we are going to be giving it as soon as we get it ready to go. And then we are going to be documenting back on our MAR and on our documentation. So I will perform correct hand hygiene. I'm going to look over my order from my MD on the MAR. And our vial is going to contain 2 milligrams per mil. I'm going to make sure and check my vial, make sure there's no cracks, there's no particulates, that the expiration is good. This one is not a multi-dose vial, so we will toss this after we are finished. Then I am going to just roll it in my hands, make sure everything's mixed. Okay, so that is ready to go. I'm going to get my syringes ready and my needles. So I am going to be pulling this up with a different syringe than I'm going to give the patient. So the syringe, or the needle, the needle I'm going to change. This needle is a 20 gauge, 1.5 inch needle that I'm going to be pulling the drug up with, and I'm going to be attaching it to the same syringe that I'm going to use to give to the patient, but not the same needle. So I'm going to leave the needle in the packaging so it stays sterile, and I'm going to take my syringe and apply this needle to it, just like that. And then I'm just going to pull this up to 0.5 ml, which is going to be my dose. So now that I have that on there, and it's still clean, so I'm going to wipe down my vial with my alcohol. Okay, that's nice and clean now. I'm going to let that dry for just a second. Take this off. Make sure I set my cap down so that I can recap this to safely get that to the sharps container. So I am going to stick this in here. I'm going to inject my air. I'm going to make sure that my needle is into the actual drug before I start pulling anything back so I can get those bubbles out. Okay, so I made sure and got all the bubbles. I'm going to recap this so I can safely get it into the sharps container. Here, there, it's recapped. I'm going to try and recap that one more time. I did not like that. Try and pull this off again. There we go. Put that into the sharps container. And now I'm going to get this needle that I kept in the plastic wrap to make sure it stayed sterile. So put that on there. And now it's ready to go into the patient's room. I'm going to make sure this is nice and tight before I move with it so that nothing happens. I'm going to take my orders with me. So we're going to come over here, and this is Mr. Rocker. So we're going to pretend like this is his deltoid muscle. I'm going to wash my hands, recheck my 6 rights, make sure that this is the right patient. So Mr. Rocker, can you give me your full name and date of birth? He does that for me. Can you go over your allergies with me one more time? And he does, and his only allergy is the Celebrex, which we do not see is contraindicated. So I will now find the location of where you want to inject on the deltoid. So say this is the acromion. At the top, you want to go 3 finger breaths, and it's going to be right in between. So right about in the center of this, So I found my location. I have a little marker there. I'm gonna now clean the site, and I'm gonna position him sitting up with his arm placed nice and restful so this doesn't hurt. Because you obviously don't want someone tense. It just hurts a lot worse. So I'm gonna make him as comfortable as possible. I'm gonna make it so that he knows when I'm gonna inject. So I cleaned the site, making sure I started from the inside, working my way out. So on this one, you will have to aspirate because we don't wanna hit an artery. So I'm gonna take my cap off. It's a big, long needle. If this was a skinny guy, I would use a lot shorter of a needle or switch sites. So for this one, I have my site. I'm gonna hold this nice and taut for him. Okay, Mr. Rocker, I'm gonna inject this now, okay? 3, 2, 1. I'm gonna go all the way full. And in the most part, we would usually go all the way in, but this needle is longer than this pad. And now I'm gonna aspirate. I actually would aspirate first and then inject. So I have done that. Gonna take this out. I'm gonna safety needle myself. Do that. I'm gonna blot. Obviously this leaked a little bit. Blot this. Okay, Mr. Rocker, how are you feeling? He tells me he's feeling well. Is there anything I can get you before I leave? He tells me no. I will give him the call light and the rails of the bed back to position, and then I will document on my MAR where I gave it, the location, my signature, and the amount that I gave. Awesome. Thanks, guys.